I am Dr. Kishore Pargaonkar, consultant physician and cardiologist for Aurangabad, Maharashtra. Today I will be discussing a few points regarding how to prevent morbidity and mortality in these days of COVID-19 in those patients who have very high risk. What do you mean by high risk? Those who have a higher age group, around 60 or more, those who have associated illnesses like diabetes, hypertension, or ischemic heart disease, or those patients who have some respiratory illnesses like asthma and COPD. We know that these patients, if they develop COVID-19, then the mortality and morbidity is very high. Overall mortality and morbidity of this COVID-19 is not that much. It's only in this certain age group and in certain disease group that if they get COVID-19, then mortality and morbidity is very high. But I tell you, this is true with any illness. In these diseases, if you get any illness, the mortality and morbidity is high. But because this COVID-19 has appeared as a pandemic and it is spread everywhere, that's why this concern. So it's not a new thing. It's a, because it is seen everywhere, we are more concerned about it. And that's why I said, don't panic. It is nothing new. If you observe few things, you can get away with this. What to do? I will describe this in just three things, 3 points. Number one, try to prevent COVID infection itself. Number two, keep your present illness under control. And number three, try to avoid mental strain and stress. If you can do these 3 things, then you can get away from all these things. How to do it? I will give some practical hints. Number one, prevention of COVID infection itself. Why this disease is dangerous? This disease is dangerous because we don't have any specific antiviral treatment. What we do once the patient gets disease is just give him symptomatic support, and there is no specific antiviral treatment. And that's why this high morbidity and mortality. Secondly, we don't have any vaccination at present which can prevent this infection. So we cannot prevent by vaccination. We cannot take vaccines. We cannot take any specific antiviral. So the best thing is to prevent the infection itself from happening. And how to do it? We now all are now aware of it. We are observing it now day to day, day in and day out. What do we do? Just observe social distancing. You have seen that around 22nd or 23rd March, when we started this observing social distance, the rate of rise of COVID infection was around 25 to 28%. And if we see today morning at around 6 o'clock, the rate of rise had just come down to 7.5% from 25 to 28%. So this downfall has come only because of observing social distancing. That is only by avoiding contact with patients, just by preventing from going out. So keep social distance, keep yourself at home. If you don't go out, if you don't come in contact with other persons who are suspected or likely to have COVID infection, you cannot get COVID infection. So as far as possible, these high-risk patients should not go. As far as possible means they should not go at all. Try to keep yourself at home and keep a social distancing. If at all you have to go out for some reason, always use masks. Do not go out without mask. Mask is a must. When you come back, keep that mask in some hot sun, under some hot sun. Now the temperature is very high. If you keep it under hot sun for about 2 to 3 hours, even if there are some germs from outside that come there, they'll all die, and you can use that mask. So don't go out. If you have to go out, use mask. And thirdly, always wash your hands regularly. If you are at home, you need not do it every now and then. But if you come from outside, because you must have tested many places or fomites where there may be viruses, see that as soon as you come back from outside, wash your hands thoroughly, at least 20 to 30 seconds, so that even if the viruses are there, they will be washed out. So stay at home, use mask, wash your hands thoroughly. See that no visitors, no relatives, no friends come to you. If at all they come, just talk to them from the windows and see that they go out. Whatever they feel, don't entertain them. That is nothing more precious than your life. So the first most important thing is prevent the COVID infection itself from happening and nothing like that. Secondly, Why you are at high risk? Because you are having these illnesses. If you keep this illness under control, then you are not at high risk. If you have hypertension, keep your blood pressure under control. If you have diabetes, keep your blood sugar under control. If you are IHD, take all your medications and keep yourself fit. If you follow this and control your present illness, then you are not at that high risk if it is uncontrolled. How do you control your present illness? Again, observing just 2 to 3 things. Whatever diet has been prescribed for you for this present illness, for diabetes, hypertension, IHD, respiratory illness, strictly follow those diets. Not that you should follow this diet in this period, but it should be followed always. But if you are not doing, at least wake up and see that you follow strictly to your diet. Because now you are at home, you should not over it. If you feel hungry, if you want to eat anything, just eat cucumber, eat tomato, and take plenty of water. Don't eat anything more in between. Whatever are your timings of food, just observe. Your quality of food, your quantity of food should be same as it was before these days. So follow your diet strictly. If you have any bad habits like smoking, tobacco, alcohol, nowadays that since they are not available, it's the best thing to get rid of all these things and quit them forever. You have a lot of time, so use them for a good exercise. You did not go out since you cannot go out. Always do your home exercises. You can do plenty of exercises in your home, or you can go upstairs and do it there also. You can do skipping, you can do Surya Namaskars, you can do static jumping, any exercise which increases your heart rate, that you can do. Weightlifting exercise you can do. Yogic exercises you can do at home. Do pranayams regularly. If you do this, this will build up your immunity. Apart from exercise, also follow that you get a good sleep. A 6 to 8 hours of good sleep, nice sleep, also boosts your immunity. And thirdly, and most important, is medication. You must be particular about your taking your medication. See that you have enough stock. All medicine shops are open. There should be no reason that you have no medicines available. All medicines are available. Keep a good stock for about a month and take your medications sincerely. If you take your medications sincerely, if you do regular exercise and have a good sleep, if you follow your diet as per prescribed, you don't overeat, you don't see that your weight does not increase, then you keep your immune status at a higher level, and this will prevent the mortality and morbidity that is there because of this illness if they get COVID-19. And last and most important is having mental peace. No mental strain and stress should be avoided. How do we do it? If you observe your TV channels regularly, then because there are so many breaking channels, breaking news and other things, you get disturbed. So the best thing, what I follow and I suggest you, is see only the national channels. National channels give everything in plain words. You get what you want and you are not disturbed unnecessarily. Just watch 15 to 20 minutes in the morning, 15 to 20 minutes in the evening, twice a day for news. That is enough. Don't go for private channels. Just go for national channels twice a day. If you are bored, if you want to see TV channels, again I suggest nowadays we have got very good serials like Ramayana, Mahabharata, Arya Chanakya and others, where if you see them, you really love them. You learn, although you know all the history, all Ramayana and Mahabharata, you relearn it. You get enjoyed in that. And not only that, you get mental peace while observing it. You also, since there is a lot of good ethics in that, you also improve yourself by seeing them. I see that many patients are very happy by seeing such serials and see that you spend your time in looking at a serial that gives you a good mental peace. There are many books that give mental peace. If you are a book lover, then spend about 10 to 15 minutes to 2 to 3 hours daily for using such books. You can, if you may not be able to sing, you may not be able to play instruments, but you can always listen to good music. You can always listen to good instrumentals, and this will give a very peace of mind to us. Thirdly and lastly, try to do some meditation daily. If you practice meditation for about 10 to 15 minutes daily, that gives you a very good mental peace. If you observe it for about 2 to 3 weeks regularly, then you will really develop a regular habit of doing meditation, and you will not forget your meditation even when you join your work later on. So this meditation, exercise, reading good books, following diets and habits that will give you a peace of mind and that will help you from avoiding any problem in these things. So this is what I suggest. This is very simple. This is very simple. Prevent your infection by going out. Control your present illness by just following diet, exercise, and medication. Keep your mental status at ease and utilize this time in many, many good things that you were not able to do in the past. Thank you.